Live.
Thank you and welcome to the Health and Wellbeing Board Subcommittee. This is all about the community subgroup, and we have an agenda and we have a programme to go with. So first and foremost, I don't know whether there are any apologies for Zana or Clarissa.
Yes, Chair, there's Dave Curtis, just the one apology.
Thank you very much, Farzana, for that. And are there any declarations of pecuniary interest? I do not hear anything, so we can pass on to the next item, which is the minutes of our previous meeting taken on the 6th of October 2020. We have them in our agenda. And page 1, page 2, page 3. Are there any dissenters to those minutes being agreed? There being none, those minutes are agreed. Thank you all very much. We come to one of our main items today, which is the COVID-19 update, and that's over to Dagmar. Dagmar, are you there?
Yeah, I am. Good evening, everybody. And as usual, I will give you a swift update where we are with our COVID pandemic in Merton. And I also have one slide to go through the new restrictions. And the way I want to do it is hopefully, first of all, just checking that you all receive now our weekly situational awareness report. And I've put a few more slides in with a particular Merton focus on some issues that you've raised before. So I will particularly focus on those slides, but have given you the whole deck as a sort of reference, hopefully. So Clarissa, I think you help me with the slides. If you give me the first one. If you move me straight onto our summary table. So next one, that's the summary table. That should be very familiar with you. And the unfortunate truth is that all the important indicators, which are our infection rate and our positivity, and also the impact on the NHS, are still going in the wrong direction. Now, you have to be aware that we are not only monitoring weekly, which I share with you, we are actually monitoring all the time. We are like slightly obsessed. And so this slightly better news over the weekend has been that the very steep increase that I've now reported on a weekly basis seems to just level off a little bit. So cases are still absolutely on the up, but not quite as steep. So that is me ever positive. But I wouldn't for one moment say we are home and dry, but I wanted to share the very latest, which was slightly more upbeat. If you move me on. Clarissa, if you give me the next slide. That is just a reminder that Merton is not on its own, and we always look across London. And it was interesting when I started sharing these slides with you, it was all green. And now we have basically run out of red. So we've introduced purple, and Rachel, our Director of Children's Services, has called this the bruised look. And it basically indicates that infections have rocketed up so high that they were really beyond what we had expected for this time of year. So we had to introduce a new colour. And you will see that I think it's Hammersmith at the moment is reached over 200 infections per 100,000 over 7 days. So that is really big sustained community transmission. If you move me on. This is the picture that worries me most. We do know that initially when the cases started to go really up, it was in the young age group, and youngsters often or mostly have a minor or mild infection. The over 60s are the group with the highest risk. And we are now measuring what the infection rate is. And you see where Merton is, we're already in the red, and the bruising is starting to creep all over London. So that is what makes us all jittery, because to all intents and purposes, once you have got infections in this age group, they will tip over into NHS admissions with more serious disease. If you move me on. This slide just very briefly shows you how we were trundling along quite happily over the summer, and then the very steep increase from the middle of September. And that is what started to really focus the mind and to be honest, started to panic people and jerked us into more action. If you give me the next slide. And this is a really important slide because you can say, well, infections on their own don't really fully describe the harm. But once we look at infections and COVID admissions in hospital, that is harm, because obviously only really serious infections get admitted. And the turquoise line is Southwest London. So you see that we are still at the lower end of what happens in hospitals, but there is clearly a creep up. It's not a complete steep up, but it's a creep up. And if you look at occupancy rates, that's on the left bottom hand of what's happening in the NHS, it is filling up. And obviously we are in the autumn approaching winter. That is a notorious time to be busy for the NHS. And this time round, the NHS is not just focusing on COVID. The NHS is very busy with focusing on all sorts of other things, rightly so. So we're watching these slides very, very carefully. If you move me on. So now I share with you a few slides, particularly around Merton, where we have done some more analysis. This one is still one that you should be familiar with. We are obviously monitoring death. That is the most horrific outcome of COVID. We've been at 205 all through the summer. We have recently counted 2 more deaths. It is important to understand that one of those deaths has actually occurred in August, but the way the data get registered, there was a delay, and possibly for a coroner's case, I don't know. But so one belonged into the first wave, still into the tail of the first wave, and one additional death from the second wave, which occurred in hospital. If you move me on. This was last time one of our points of discussion. It was all around testing. It was at the time when testing capacity in London had been diverted to the north of the country, and people had to go miles and miles for a test. It was very undesirable. I'm glad to say that has been resolved, so there is ample test capacity. We also have got a local walk-in testing site now that is well used. And so generally testing is on the up, which it should be. And for you all, as when you liaise with your constituencies, please make that very, very clear. Because there was obviously a lot of noise in the system, how awful testing was, putting people off. Now everybody really should get a test very quickly. Where we still have some problems is turnaround times. You will have heard in the news there is still a lot of discussion how to improve, and lots of London work going on with local contact tracing, complementing NHS TNT. If you move me on. This is an important slide because it shows us where our outbreaks are, and you will see in the key messages we have a number of outbreaks in care homes. That obviously is really worrying. That is where our high-risk residents live. The good news amongst the worrying news is that so far all the incidents and outbreaks in care homes have been with asymptomatic staff and residents. We haven't had a single symptomatic one. So they all have been found through the regular care home testing, which is happening. Again, it is sometimes still unsatisfactory delays in test results, but all in all, this is pretty well established now. If you move us on. This is obviously really crucial for Merton. We keep a very close eye on the east-west differential. You will see that there isn't really a clear conclusion yet. Sometimes the West leads, sometimes the East leads. And so for me, at the moment, I'm in observing mode. I will not venture into conclusions at the moment. If you move me on. This is a really important slide. It is something that I mentioned before. You can see what we call the heat map on the right-hand side. It shows you infection rates by age bands, and if you just look where the most orange is, you can see it clearly in the young age group. But you also see in the most recent time, which the timeline is on the bottom, that it starts to bleed into the older age groups, and that is what worries us, because that's where the harm comes into the equation. If you move us on. And this is an interesting one, because we heard about it before and didn't have much data. There's the story around the students. So we are aware that university students have sometimes not changed their GP address. And then that NHS Test and Trace has used their GP address to allocate where they live. And consequently, quite a number of positive student results from the Newcastle, Nottinghams and Manchesters of this world have been counted to where they have their original GP. And we looked, it is not a direct analysis. We have to sort of look where basically the test has been done. But if we use these proxy measures, for the age group of students, which we have said 18 to 21, Merton is right at the top of youngsters that have taken their test in one of the northern university cities. So we think some of those are actually not in Merton. If you move us on. So that is it just gives you a snapshot of some of the data that we are poring over. And this is just a very brief summary as a reminder, really, that at the moment we are in tier 2, and that obviously we're expecting the parliamentary debate about another lockdown tomorrow, with the proposal to start from Thursday till hopefully for a month, beginning of December. And I've listed just the outline of what the restrictions mean. There's lots of work now to actually really try to understand what it means for specific settings. And I have to confess, I haven't got it all up my sleeve. We're working behind the scenes to try to make sense. So over to any questions.
Any questions? Do feel free. Just from me, Dagmar, and then I'll see if anyone's put their hands up. The bleeding of the hot spot of the youngs,
Yeah,
into the elderly. Is that the youngs having contact with the elderly, or is that just happening for all kinds of reasons?
well, it's a good question, and we're trying to understand it. We do think that the middle band, the working age adults, might play a role, because they are in contact with school children, and we clearly had quite a lot of infections in school-age children, particularly in secondary school. And those often also have caring responsibility for their relatives. So once you have got the infection spreading in the working age group, there's often then the next step that it goes into the over 60s. And obviously, as you're all aware, there isn't explicit shielding. I think all shielding population have got a letter to say be careful, but it is actually the reality of where older people can come in contact with younger people, if you think about it, is quite common and very difficult to say keep them all apart.
Thank you. There's a question from Rebecca.
Thank you, Chair. Just a question about whether we have any data on the breakdown of sort of infections and sort of the other data on sort of BAME population. I know that's something that we've talked about before, and the impact being sort of unequal. So just a question as to whether or not we either have that or there's sort of work underway to look at that.
Yeah, so we can, I think it's a good point. What I suggest is maybe in my next update, I will try to do a bit more of a deep dive and find out the BAME distribution. We get it now from London, so I will try to produce a distribution.
Okay, any more questions from anyone or comments? Councillor Stringer.
Hello, that's really useful, Dagmar. I always find this so fascinating, if slightly terrifying. I'm going to ask a question about schools, as you'd expect. So kind of two parts. What evidence do we have so far that there has been any transmission within schools community? And the second point I'd like to raise is, I gather from my officers that head teachers are now essentially responsible for their own testing and tracing. I would like your thoughts and comments on that, please. Thank you.
Yeah, so both really helpful questions. So the first one around how much spread have we got within schools? It's probably helpful to do a bit of a split. So we have some, yeah, and where we think transmission happened is if it is a mix between staff and pupils, and it tends to cross the year groups. Now, the majority of our school outbreaks aren't of that ilk. There's one or two, but the majority aren't of that ilk. The majority actually are amongst staff. And that is the reality not only in schools, but in other workplaces. So if we look in care homes, if we look in workplaces, the message that seems to have got through is that workers really care about their clients, teachers with their pupils, care home workers with their care home residents, healthcare workers with their patients. But when it comes to taking that face mask or PPE off and have a cup of tea and share a room and share a computer, that's how transmission between staff is happening. And that is the main picture in school. But I think it's a bit of a Weasley question, because you are right. If I, for example, speak to my daughter, she's in secondary school, she sees, Mum, it's blatantly obvious what happens in school and how we mix and what we do and what we not do. And secondary school pupils behave much more like adults. They don't get ill, but they transmit. The little ones, we're now saying, sort of the epidemiologists tend to say, if it's below GCSE, the youngsters don't transmit very much. Transmission chains often break off, yeah. But the older ones, they behave much more like young adults and university students. So I think, therefore, it might be that the levelling off I mentioned to you right now, which made me just that slightly bit more optimistic, might reflect that we had a holiday. We just had a school holiday, which might have dampened down some infection. So as you have heard as well, from a policy point of view, I don't want you to now jump to a conclusion and say, okay, that means, you know, schools might contribute and we need to think about school closures. I think the policy is very clear at the moment, and I am absolutely supportive of the policy, because the harm of not having kids in school, in my opinion, outweighs the potential spread that they contribute. But it is important that we look at it objectively. And then the other one was, yes, schools have now been asked to do a risk assessment if they have a single case, or even some cases that are not complex. There are proper flow charts. And I have to say the schools have been amazing, because when I saw this coming, I was actually taken quite aback and said, wow, you know, we're just moving a burden onto already really, really burdened profession. And they have been amazing, I have to say. And I was on call even over half term. And I was worried because we had said, listen, half term, the teachers really need it. And there were cases in schools. And I was on call, and the head teachers phoned me just for some reassurance. They were brilliant. They had done the risk assessment. They had followed it. I was in awe, to be honest, without grumbling, on Sundays, in their holidays. So I have to take my hat off to our head teachers that they have absolutely pulled up and have shown a lot of solidarity with that.
Thank you, Dagmar. I've got Mohan and then Vasa. Mohan.
Thank you, Chair. Dagmar, interesting stats and a couple of comments actually. I suppose the data you've got is up until the 16th of October, so I think the next 2 weeks after that will be quite interesting to see. But also the East and West splits. I think in wave 1 we actually had 2/3 in East and 1/3 to West, and now it seems to have leveled out. But you said that it keeps chopping and changing. But I did have a question, and I think I should know the answer to this, but I don't. I'm interested in Liverpool. They're doing that testing for all. And something which triggered my mind was when you talked about the care homes and having asymptomatic staff. And I just wonder whether asymptomatic patients don't have as potent strain as someone who's symptomatic, i.e. they're sort of shedding their load more. And so someone who's asymptomatic, even though they've still got the coronavirus, it's not as potent as someone who's shedding the virus. So I don't know, yeah, if that makes any sense.
Okay, all interesting stuff. So East-West difference, very good question. If I can remind you that in the first wave, we didn't really have good data on infections because we didn't test. So where we had the East-West difference was unfortunately in deaths. And it was at the beginning of the first wave that the East was leading. Towards the end, it leveled out. So it wasn't quite as stark. But overall, there was a slight increased death rate in the East compared to the West. Infection rates, I'm just not confident. So that's in terms of East-West. Hence, we are really, really keen to monitor. And then Liverpool, yes, it obviously captures everybody's imagination. The new test, which is called the fast test as well. And the important bit is you don't need a laboratory. You do it, you wait, and you get the result. And it will come, and we are promised that it will be rolled out, and it will help us as another tool in our toolkit to manage the pandemic, particularly, as you said, with testing of asymptomatics. Now, this infection is so problematic to control because a lot of transmission happens from asymptomatic people. Initially, we didn't think. We think you needed to have symptoms to really spread. We now know that you're most infectious 2 days before onset of symptoms, on the day of onset of symptoms, and then it drops down pretty quickly. So even the most world-beating test and trace cannot really manage that very well. We do not have any evidence that there are different strains between asymptomatic and symptomatic. It's just that is how the pandemic behaves.
Thank you. Vassan, the last question, I think.
Thank you, Chair, and thank you, Dagmar, for, as usual, a brilliant summary of some important facts backed with evidence. The issue about institutional spread is a big problem for all of us, and it's also a problem for our workforce who diligently observe IPC when they are interacting with people, their patients. But it's when they literally let their hair down and relax for a moment or two for a cup of tea and a little bit of a biscuit. That's the time we inadvertently infect each other, and we are working very hard on it, but we're all humans, and I think it's inevitable that we'll have institutional spread, and especially for a disease which has got this significant asymptomatic component. I think we need to accept that, that masking and distancing is all what we have as disease prevention. Everything else is really doesn't have much effect, and as long as we can be consistent with that message, And that is the only message, whether we are a school teacher or a healthcare worker. All what we can do is we can follow what we can do and distance and mask without pretending that something else is going to come and help us at this point in time. And I think, thank you for emphasizing the importance of that. And all of us have a duty of care with this agenda. And yes, our children look at us, and our children are, as usual, very observant, and they're actually honest. They're more honest than I am. And therefore, when they tell us something, I think we must learn to listen, because they don't pretend. I can. Thank you,
Vasa. That was a good comment. Thank you. I think we're there with item 4. Thank you for the update on COVID-19. Dagmar, I certainly always find it very, very useful update. We move on to item 5, which is our engagement and insight work with our communities, and over to Kaz and Barry. So, Kaz or Barry?
Hi, Chair. Kaz is going to start this item for us. If we could put the slides on, please, Clarissa, and then hopefully Kaz will be able to take us through.
Okay, Kaz.
I think Kaz is struggling, Barry. Can you take over?
Yeah, no problem. Kaz, if you get the mic working, let me know. Thank you. Next slide, please, Clarissa. The key focus for us this evening on our deep dive is really to think through about mental health and wellbeing. So thinking about the aims and key principles of the community subgroup, we're going to give you an update on Thrive London so that you're sighted on the work that's taking place across London. Going to give you a bit of an idea on what we've heard from our communities on the impact of mental health on mental health and wellbeing. And then we're going to get, as soon as we possibly can, into that focused discussion on three key themes about adults' mental health services, children's mental health services, and then also thinking about staff and volunteers' wellbeing. Next slide, please, Clarissa. Kaz, do you want me to carry on? I'll carry on, colleagues. So
checking that I'm on.
Kaz, I think there's a connection problem there. I'll carry on for the subgroup for you, but please do feel to come into that conversation. So Thrive London is led by the Mayor of London and the London Health Board, and it has coordinated the public health mental health response on behalf of London. So all of the boroughs, the NHS across London coming together. And what it's done really, really helpfully, thinking about what they can deliver at scale, they've produced wellbeing guidance in 27 different languages in culturally competent formats, which we can use to pass to our communities within the borough. They've also funded youth mental health first aid. So that's a digital version of a course which really supports our young people, but also education staff and their parents. And that's been taken up quite a lot within the borough. And Thrive London at that pan-London level, again, have expanded their suicide prevention programme to include providing support to those who are bereaved by suicide, who we know are at increased risk of suicide themselves. What we've got there, we hope to develop the slides so that they're a resource for you as well. So the website is there, and I would really encourage you to sign up to the newsletter. It has lots of practical tools and services that community subgroup members will find of help and of use. Next slide, please. What we've heard from communities, as many of you...
Hi, folks. I'm just wondering if I'm on mic now.
Go for it, Kaz.
Cheers, Barry. Sorry, that was a bit of an adventure to get my computer to cooperate. And thank you, Barry, for riding to the rescue there. So what we're hearing from our communities, so the engagement team between the months of April and August, carried out some early insight work during the first lockdown and into the summer. And that elicited views that are timely, I think, once more, given the impending return of restrictions. A picture, I think, was painted of significant stresses on communities and indeed families as the impacts of the pandemic on livelihoods created hardships that challenged perceptions of their identity and their control over their lives. So, for example, feelings of shame with regards to loss of employment, acting as barriers to engagement with services. We also heard of feelings of guilt and burdening the health service while it was struggling to deal with the pandemic. And this, coupled with fear of contracting COVID in healthcare settings, many people were willing to put off engaging with healthcare professionals about non-COVID symptoms. The switch to virtual provided some positives for people who have mental health or learning disabilities, so that where they faced anxiety with organizing and traveling to appointments, the virtual provided a way of being able to sort of sidestep those challenges. However, in some cases, these changes created barriers for people without the access to the technology or communications infrastructure, as well as other specialist communications needs, for example, needing British Sign Language interpreters or speaking English as a second language. As well as fears about getting ill, we also heard that some of our residents are isolated, and the impacts were felt quite keenly by young people and elders, as well as folks with learning disabilities. Moreover, there were anxieties about the future with regards to education due to exams, financial hardship, and employment opportunities. And engagement group members noted that in overcrowded households, it's been difficult for people to get the kinds of privacy they need to talk about what they are experiencing. So for us, I think this underlines the importance of a few things. So making sure that services had clear communications and messaging about what we are doing locally to keep people safe and what's available to people. Making sure that we have a range of communication methods to reach a wide range of people, and building relationships with both formal and informal community leaders to make sure that what we say has credibility and is likely to spur action. And finally, to make sure that we're able to link and signpost people to the services that they need. Okay, many thanks. I'll leave it there and hand back over to Barry.
Thank you, Kaz. And I'm just going to build on what Kaz has said there about what we've heard, because we've worked really hard to listen to our communities, to really understand what's going on, to inform our approach. So I will do my best to help you understand some of the key messages from our services, but I'm not the lead commissioner, but I'll do my best for you as ever. Thinking about adult mental health services, Merton Uplift, commissioned by the CCG, they've worked hard. They've opened up the Orchard Suite, which is about mental health emergencies, but also opened up a 24/7 support line, which many of our residents are accessing. What they've seen from their activity data is that there has been an increase in activity, in part because they responded very quickly to develop those online services. But what we don't know just yet is if that increase in activity is from new people accessing mental health services, or those that are already known to services, or perhaps a combination of them both. And again, thinking about the types of referrals and that the service, Merton Uplift service, is seeing, they have seen an increase in urgency, and the complexity has increased in those referrals during those difficult 6-7 months. And again, as a resource, the website's there, and we've got the phone number for the 24/7 support line. Thinking about Good Thinking, so that's London's digital wellbeing service. This supports common mental health conditions like anxiety, low mood, sleeping difficulties and stress. It's a very good website, it's evidence-based, and the boroughs come together with the NHS to fund this. And what they've seen is a 300% increase in the number of people using that resource, with 108,000 users visiting the site on many, many occasions. And the key reasons that have been reported to accessing those Good Thinking evidence-based resources are alcohol problems. And again, within Merton, we have good substance misuse services to support people around alcohol problems, anxiety, and also sleep worries. So again, we can see these mental health, that stress and that anxiety having a knock-on effect. Again, the website is there. It's a very good website. It's got good evidence-based tools. Next slide, please, Clarissa. Children and young people's mental health services. And again, in a similar way to the adult services, these services initially saw a drop in referrals, but then now they are returning to those usual levels. Really interesting and worrying. they have seen an increase in eating disorders during that period. And again, that's something we need to look into really in depth to see what's going on there. And again, similar to the adult service, a 24-hour crisis helpline has been put in place. And again, there's an online offer to support new and known patients. And they're also piloting a self-referral for 16 and 17 years of old young people to access CAMS and the websites there. Second type of service there is off the record, which is a talking therapy for 11 to 25-year-olds. They offer a range of different channels, so different ways of delivering that service. Some of them are face-to-face, following that appropriate risk assessment, but also real-time chat and own-time message chat. So that's really responding to what young people have been telling the service about wanting to do those interactions on their own terms. And again, they've been proactive in their approach. They've developed several interactive and recorded webinars on key issues around emotional health and mental well-being, linking into our schools there. And then the third service, just to give you a very brief overview, is COOTH, which is an online counselling that supports children and young people's emotional health and well-being. Again, this has been open to all schools within the borough, and the increase in referrals has been seen. And again, thinking about the reasons, why are young people contacting COOTH for their mental health and well-being? It's around bereavement and loss. It's about educational concerns, but then also about family concerns. They're worrying about debt and employment and their parents and those home circumstances. But also their own behaviours, or their behaviours that are challenging children and young people with autism or learning disability. And again, our young people are reporting anxiety, low mood and sleep issues. So there's significant amounts. And so it's really the right topic for us to be exploring this evening. Nice. Next slide, please. And let's not forget about our frontline staff and our volunteers across the borough. We have a huge number of staff that are doing amazing things. We've got a huge network of volunteers that are supporting our most vulnerable people. Just two examples there on how we're trying to support staff and volunteer wellbeing, mental health and wellbeing. In recognition of that disproportionate impact on ethnic minority groups, we in the borough, we've facilitated staff to set up a BAME staff network. And we've also commissioned, again, in partnership with the CCG, for some training for frontline staff. And this is for staff in the borough, the CCG, primary care, but also in the voluntary and community sector, to be mental health first aiders, mental health first aid champions. So again, thinking about how our community subgroup operate, perhaps they might want to be a champion. But we've also got some shorter awareness courses. And really importantly, we have 100 places on suicide prevention training. This is again an evidence-based way to identify and then to be proactive in supporting residents that might be struggling at this stage. Again, the contact numbers and details are there. Next slide, please. And again, the key questions for us to consider as a group, and I'll hand back to Stephen. So what impact, when we're thinking about mental health and wellbeing, what impact have you seen in your community, and what can we do to mitigate or amplify it? How can you help us connect services with the most vulnerable groups? And what else can we do to support paid for our frontline staff and our volunteer workforce across Merton? So I'll hand back to Stephen to chair the discussion.
Thank you very much, Kaz and, and Barry. A lot to think about there. We've got 15 minutes of discussion on this item, provided, of course, that we take 5 minutes on our last item, but that can stretch to 10 minutes. The last item is on training and communication opportunities. I'm sure that'll be informative, but we do have a good 15 minutes on what we've just heard with what's happening within the community for staff, for children and for adults. So yes, and it's comments and questions, of course, but if it's a discussion and comments. Councillor Una Moulton.
Great, thank you, Chair. And I'd like to thank, well, first of all, Dagmar for the earlier report and this one as well. They're very comprehensive. Obviously, mental health and well-being, for me, is a huge side. We know we're now into, well, it's going to be heading into nearly a year, you know, that people are being affected by a lot of things going on. And I just wonder how that there's a lot of people, we always talk about the sort of hard to reach, and you touched on slightly as to, in some earlier work, as to whether people have actually come forward previously or whether it's new cases, and that's obviously a big concern. And I just, it's really how are we going to, what structures? I know we've got the COVID champions and they're doing really well and the numbers are increasing. And obviously I'm, going around as well as one of those trying to, highlight, but that's limited. And I'm just wondering, how do we get out that there is all this? I mean, that there's some wonderful support, but it's really how do we get out to and get it out into the community, because some people just don't turn up to GPs, and so referring, I suppose, is what I'm saying, is quite hard if you haven't actually found the person in the first place. So it's really just a question of, this is great stuff, but how do we really highlight it, particularly in this COVID time when some of us aren't going around perhaps quite the number of events and quite the number of residents associations and so on. I mean, we're limited on Zoom, and I think, and maybe the small talk and the different things that we're used to as counsellors, and I know in other partners aren't happening in the same way. So I just worry that we've got these structures, which are great, but how, I suppose, do we really get them advertised and out there, given that a lot of people we want to get to aren't necessarily on Twitter, don't necessarily go to some of these things, and in fact, if anything, are probably going inward on themselves, as we know people do when they're troubled. Yeah, so that's it's a rhetorical question really, but I think it's an important one, because we've got these services, but it's really trying to get to the people that really need them. Thank you.
Okay, we'll let that hang, and perhaps others will come in on that, Una, and perhaps at the end, Barry may have an answer there, or when we get on to communications. Mark and then Vasa. Mark, over to you first.
And apologies for my late arrival. I was having some technical issues like Cass. Just to say that I think Councillor Moulton raises some really, really important points there, because I think historically, and not just Merton, I mean, generally we've used very Eurocentric kind of communication channels to try and reach our hard to reach populations. And what we need to do is kind of listen to our populations in terms of the best way of getting the information to them. And that might be through our faith leaders, it might be through our young people. Martin might be able to advise us what's the best way to get through to young people. But we need to start kind of listening and doing communications on a very different way, so that we are actually getting into the communities we're trying to reach.
Okay, Vasa, and then Mohan.
Thank you, Chair. It's a very important question from Councillor Moulton, and I think one of the important things for us to remember is actually they are not hard to reach. It's we who are hard to reach. They exist in spaces, we exist in a different space, and therefore they can't reach us. And I think the way to look at this is to actually talk to the young people, because more and more I find that my method of communication is exactly like speaking to a wall, because I can't communicate as well as their own peers, their own friends, and their colleagues communicate with them. And no point my pretending I can. And I think what we need to do is to use social media. We need to use schools as a forum of health and well-being. And that's why I think it's very important that we need to have the schools open as much as we can, because that's the place where people share, gather, they laugh together and they cry together. If I look at my children, I know when one of their friends is in trouble, because they come home and say something to me about something else. And I think it's about listening and creating the space for young people to be free. And Mohan blogs, I don't. And I think we need to make use of people who use that type of communication to showcase what is available.
Okay, thank you. Mohan.
Thank you, Chair. And yes, I think I want to touch on all those points, actually. And I share the same sentiments. I think what COVID has done is kind of taken us back to the dark ages. No matter how much technology we've got, we're actually back into isolation, we're back into our basics, aren't we? And actually, it highlights the importance of community and connecting and having those links, faith leaders, having the young population as well. I think education, online resources, webinars, connection, that's our medium at the moment. I would say that we're actually quite fortunate in Merton. I mean, Barry and Kaz showed some great online resources there, and that's really helpful. Mental health is going to be massive at the moment. It's going to be massive in the next few months because of the way COVID has happened, and also because it's winter. So I think those resources, I think the social prescribing as well, we've got 9 link workers in each of the practice. We've also got the voluntary hub. Those are things which other boroughs haven't got. And so we're quite fortunate to have those infrastructure in place. Another couple of roles I want to add as well, which are coming to primary care networks, health and wellbeing coaches, and also care coordinators, which we're actually recruited to in our network at the moment. And that's looking at people's health and wellbeing individually. So I think all these elements coming together and advocating and also educating is what we can do. So yeah, I think I'd advise all those. Thank you.
Thank you. Martin, our young inspector.
Thank you, Chair. I've just been listening to all of the information. Obviously, I'm quite new, but I just wanted to say, well, there are 2 things actually. Number one is I'm a university student. I'm 25, so I suppose I'm part of the red bar that Dagmar was showing of, and obviously it's very hard for students right now because all your lessons are online, you can't meet friends, all of the expectations of being at university are completely different. I'm a course representative as well, so I'm having to make loads of changes for my master's program to work effectively. So there's all of these things that are impacting universities themselves, and that's impacting students. So when I talk about people of over 18 up to 29, there's obviously another thing to mention is that they're all in occupations that tend to be manual. So of course they're getting more, the rate of COVID is higher because they work in manual places where they're exposed, they're more likely to be exposed to COVID. So of course they're contracting it. So there's that as well, that it needs to be highlighted. So it's not just students meeting each other, but it's also people that work in, minimum wage jobs, like the way that I have to do to fund myself to go to university. So there's all of these things that I think is impacting that. And my question to everyone here is, how are we supporting these people of 18 to 29? How are we making it easier for them to get tested? How are we able to reach them in most places of transport, wherever it is that they go? How can we support them? Because they're our residents, and how is it that we can particularly help them? And secondly, now to talk about, we're talking about schools and we're talking about young people, now we're talking about under 18s, if you want. And obviously we're about to start another program where we're gonna do some work related to doing some engagement out to schools and youth clubs and all kind of organizations, voluntary organizations that work with young people. And so, hopefully we're going to be able to get some younger community champions that are going to be able to help us spread these messages. And that is the aim. And of course, going into a second lockdown now, we're going to have more time. And so there's going to be a lot more kind of expectation on this work and how we can do some outreach into schools. It's actually a good thing that schools are still open, because they enable us to continue to work, rather than if they go home, it's harder to reach them because some young people don't want to connect on anything related to politics or related to COVID, because they just want to be at home entertaining themselves. So it's actually a good thing that we have schools still open so that we can still continue to engage. So those are kind of my questions and my thoughts, and thank you.
Martin, thank you very much. Over to Abby.
Thank you, Chair. Some really good points from everyone, but I just wanted to come back on some of the things that Martin said. I think the point about kind of, we're about to be at home and have a lot more time on our hands to kind of engage and do the right things. I think also just reflecting on the last period of lockdown, I spent a lot of time in kind of group chats, family chats, friendship chats, dispelling false news, essentially. People see things and they spread very quickly, and I think you're not having those conversations you know, out loud and having those opportunities to discuss and debate in the same way. So I think there's really, you know, a role to make sure that if we are, you know, we can be a voice that is able to share the correct information, able to point people and signpost to some of these links that are going to support them in kind of figuring out what they should be, you know, worried about and how they can kind of overcome those things. We really need to have a role in that. It came up for me as a thought earlier as well, just with some of the services that were mentioned. I think for some of them, it's really clear kind of what routes you take to access those. For others, and I did just kind of have a quick Google, I wondered kind of what route I would have to go through. And I think if you've got kind of young people, for example, or just kind of general members of public who, you know, have that seed of curiosity, they're thinking, I'm feeling a bit like I should maybe get some help. I go onto Google and I can't quite figure out what resources are for me. I think that's where we kind of need to put a bit more effort into making sure that people can pin down what is for them and how to kind of follow up on that, so they don't kind of fall at the first hurdle of actually trying to get some help and support, or just information in some cases.
Thank you, that's all good stuff. So we're coming to the end of our discussion, but there's time for one or two more comments or contributions. Rob.
Thanks, Chair. Yeah, just to absolutely echo everything that everyone said, really. I think for starters, the work that Barry and Kaz have done there around engagement and gathering together those issues and themes that are emerging all the way across the age groups, all the way across, you know, that there's a whole load of commonality in the things that people are facing, and a lot of it is around the uncertainty that people are facing and the transformation that's happened to people's everyday lives. So it's kind of useful to have that thematic feedback to understand what the issues are. But I think it's really great that we've got all of those mental health resources and places to go to. But to pick up on Abby's point, I think there's a little bit of a barrier around mental health in and of itself. And so I think the work that's being done around mental health first aid for young people sounds really positive, and I would absolutely endorse that as a upskilling young people to just have those sensitive conversations with their peers, to recognize when someone's going through something, and then knowing how to connect that person with the support that they need, I think is going to be something that's going to be really, really valuable over the next period. And I think just that, I think Vasa was talking about it really, that kind of community engagement. So we need to collectively as a system meet people where they present and on a level with them as best that we possibly can. So working out which channels are going to work most effectively. But I also think that it comes down to people and leaders within the community and being able to enable our colleagues and partners across the whole of the community to have the difficult conversation if they can see that someone's struggling, to open up and say it's actually okay to talk, and those sorts of things. These are the concepts that we need to just keep pressing upon, because I think if people don't talk, you can't identify the problems and you can't help connect them to the people, to the support that they need. So I think that process, I think, is going to be really important, and it's about empowering people to get the help that they need rather than infantilizing people and kind of pigeonholing them. And I think that's quite important within the language that we use when we're having those conversations too. So I think knowing what the problems are is really helpful, and really positive to see some of the thoughts that are coming through and the range of services that we can connect people to. So thank you for that.
Thank you very much. If I can go, we're finishing on this discussion, but go to Kaz and to Barry, a minute each on what you've heard, or whether you've tracked something or you've heard something really interesting. Kaz.
Thank you, Chair. So I think great points, and what my team are working on locally is to be able to connect with those informal and formal leaders and set up conversations around winter. So an opportunity for people to talk to clinicians or other relevant colleagues about what they're experiencing, and to get the information that they need to be able to participate in myth busting. It would be really useful, I think, to be able to align with our partners in the voluntary sector, because I know that you are all going out and having some of those conversations yourself, so just make sure that we're working together, and likewise with the local authority. And I know Barry will probably talk a bit more, but his team has done a great job with connecting together some informal leaders as community champions to go out and facilitate conversations with communities as well. I think for me, just some of the points on being able to meet people where they're at and not infantilize them, certainly I think where there are communication needs, such as with language, we've provided interpreters to come along to facilitate conversations. But it would be really useful to get advice. I know that we're not reaching everyone. I know there are some folks, through the way that we work, we're just not going to be able to engage, and just from people who are embedded in communities, getting your advice and guidance and support to do this would be invaluable.
Thank you. Barry, last word.
Thank you, Chair. And it's been really, really helpful to listen to subgroup members tonight. And I guess what we've been talking about is reach. How do we increase our reach? And I think it was Mohan that said that lots of other boroughs are jealous about our community hub. We have some really fantastic assets within the borough that we need to build upon. We do not need to build new networks. I attended the Faith and Belief Forum and presented and spoke to 18 of our faith leaders who all are actively engaged. We're now following up on those so we can do that. We've got the Neighbourhood Watch Network, which again have a reach into communities which we can build on, and to work out how we can amplify that reach. So we've got some small grants starting. So we're working with Merton Giving. So there's going to be some grants going out into the voluntary sector organisations, which are trusted local organisations for young people, old people, working age population, to increase the reach of our messages so we can work with them. So there's lots of ideas there for us, and that's been incredibly helpful. Thank you.
Thank you all very much. That's been a good presentation by Kaz and by Barry, and a good discussion by everyone, with Kaz and Barry coming in at the end. We're now on to our last item, which is the training and communication opportunities around COVID-19. I've got Kaz here, and is it Barry or Hattie?
I think it's me again, Chair. I think there is a slide, Clarissa, if you're able to put that up for me. But essentially, next slide for me. Next, that's it. It's one slide. And essentially, this is to ask members of the subgroup, what training or communication support do you need to be able to help us to identify and support vulnerable people? What do you need to be able to do that effectively? How can we work together on establishing that dialogue, ongoing dialogue with the community to understand that lived experience, help prevent outbreaks and mitigate those social and health harms, delivering that proactive comms, which we've spoken about, but also increase the reach and effectiveness of community champions. So really, it's an open question to members about what support do you need from me for you to be effective?
Okay, thank you. So it's a short, sharp ask. We can think about it, but if something springs to mind now, please do come in. Or you can email Barry offline and online, sorry, and with that request. Barry, if you send that that one and only slide to us, that'll remind us that you're actually offering us something here that we may or may not want to take up.
Shall do.
Okay, I think receiving the slide will be enough on that item, unless anyone wants to come in. Okay, well, it's nearly 6 o'clock, or 1 minute to 6. I want to thank everyone for their contributions. Martin, our young inspectors, had to go off to work, and want to thank everyone and see you at our next meeting. Thank you.